All right, I'm Dr. Kate Walker. This is your Step It Up training for Tuesday. It is June, not 12:02. It's June 13th, and that's important when I talk about legal things. If you sign up for Ask a Question of a Lawyer, Ask a Lawyer with the amazing attorney and LPC Supervisor Laurel Clement out of Dallas, we make sure that whenever we talk to an attorney, or we talk about legal issues, that we give you a nice timestamp. So if you are participating in the training live, if you're going to be joining me via a Zoom link, awesome, I'll see you soon. If you're watching me on Facebook and you are going to write stuff in the chat, if you're listening to me on the podcast or watching me on a replay, bless you for taking time out of your day to learn stuff that's going to make your practice even better. It's going to give you peace of mind, which means you'll free up all that brain space so you can do some creative things and really grow your practice and do the things you need to do. So the topic today is HIPAA and known issues. What can get you in trouble? So HIPAA, and I said this in an email the other day, it's like mapping a labyrinth. You know, it's a big issue and things change all the time, and not just the government part of it, the technology, because really that's what HIPAA is designed for, this information that we are holding on to, that we're entrusted with via electronic means. So health information portability, PA, I always forget what the other acronyms are, but I'll be sure to put them in the show notes. It's talking about information, protected health information, PHI, and sensitive information. Now, I'm not going to get into all of the definitions, obviously, if I forgot the last two letters of the acronym in this training. It's beyond the scope of that. I've got a course for that. If you go to Kate Walker Training, there is a HIPAA course. There's a 3-hour course for licensed folks. It'll give you 3 hours, 3-hour CE. I also have a course for non-licensed folks who don't need the CE, and it's shorter, and it just gives you a background and sort of the basics on what you need to do to protect client health information and any sensitive information. And one of the things I've learned is that mental health records, mental health information is valuable. And it's even more valuable than medical records. It can just be, you know, I guess if you went on the dark web, you would find that the price is much higher for mental health records. And I know that's awful, and that's sad, and that's terrible. And it means our obligation is that much higher to protect it. Now, I've talked about, you know, there was a time when I'll own this, some of us got hung up on this term covered entity. And if you go to the Health and Human Services website, it defined a covered entity in these particular ways. And if you didn't meet that criteria, you're like, I don't have to follow HIPAA. It's no big deal. No. Right? Texas has a law called House Bill 300 that mirrors HIPAA, and our licenses, LPC, LMFT, social work, psychology, and the rest, actually put that verbiage in the rules, must follow HIPAA. So this isn't an option. So diving into HIPAA, again, I'm not going to get into that in this brief training, but I mean, if you want to jump on, you know how this works. I'll talk, I'll teach. And then at the end, if there are questions, I can hit the pause button so that you aren't on the recording that goes on the podcast and the YouTube. So, and I'm going to keep an eye over here for comments as well. So one of the first things, we kind of have a problem today because the Health and Human Services website isn't doing what I want it to do today. So I don't know if the website is down. Not to worry though, I'm still going to show you screenshots. So if you're watching the video, you'll still see the shared screen. If you're listening to me, don't worry, I'm going to describe everything to you. So let's talk about violations and known issues. What can you control? What can you not control? Because There's no grandfathering in. Once a violation has occurred, you have a particular amount of time to notify a certain number of people, believe it or not, certain entities, certain individuals, and the violations come with consequences. And it doesn't matter if you didn't know, right? It's like speeding through a small town. I didn't know that you couldn't turn right on red in your town, sir or ma'am, right? You are still obligated to follow the law. So let's share screen and take a look at what's available. So what you should be seeing is just, I Googled, my friend Google, right? So I Googled HIPAA known issues. And what often happens is you'll see other websites before the government website. That's not always the case with the IRS, but because, well, I don't know, because of the Google algorithm of the day, we have non-government websites coming up first. But I'm going to show you in a second why that's not a bad thing, because when we get down here to the healthandhumanservices.gov, let's click on top 5 issues and investigated cases closed. I'm going to open it in a new. Oh, it opened. All right, good deal. So that's good. Earlier it didn't. So I had some backup websites I was going to show you. So the top 5 cases and permissible uses and disclosures. So we can go Google around and click around in here. You can tell by the sound of my voice, I want more stuff here. You can look at your rights under HIPAA, special topics, enforcement highlights, case examples. So general hospitals, health plans, outpatient facilities, pharmacies, private practices. So I'm clicking on the private practices link, and it just took me right back to where I was. I'm not sure why that's the case. Let me try that again. Okay, so this is why sometimes having another, even though it's private, even though it's something generated by a corporation or another entity, it's not a bad idea to look at other things besides this. So private practices, an entity rescinds improper billing for medical record copies. Private practice implements safeguards. Private practice revises processes to provide access to records. So revising access policy. So there are some things you can look at here. I am going to show you something different though, because I like simple. So when I went up here to 7 most common HIPAA compliant issues, and I don't know this group and I don't work for them. Let's see. No, I don't want to chat with you. Number 1, failing to conduct security risk analysis. Number 2, lack of adequate security controls. Number 3, inadequate device security protections. Number 4, failing to conduct vendor due diligence. Number 5, outdated HIPAA policies and procedures. I'm going to talk about that in a second. Failing to implement data backup and disaster recovery. And 7, lack of comprehensive employee training. Now, I pulled this up because when I've gone through HIPAA training, one of the things I appreciate when I'm listening to a speaker talk to me about HIPAA is they understand that I am not General Hospital, right? I am not the big giant machine with all of these things behind the scenes that, no, I mean, if I'm a solo practitioner, it's me. And if I happen to be a benevolent and generous person and I've hired some therapists to come with me or my associates, it's me and them. So I want to do the best I possibly can because my community needs me. We're in Texas. We're number 50 in access to mental health care. We don't want to play gotcha and try to think, well, I just can't do this because I don't have the funds and I'm not a giant hospital and I can't hire the people and do the things. That's what this is for, right? That's what that's what I'm here for. Other professionals are here for. We want to make sure you have the information you need to stay in business, right? You're too important to lose to breaking rules. So when we talk about things you can control, one of them is orientation and training. When you onboard someone new, that is a huge vulnerability. That is a huge crack in your system, right? Because you're bringing on someone and you need for them to do things in a particular way. So I remember back when I had associates, I was like, no texting, zero texting. I don't like it. And there were lots of reasons I didn't like it besides HIPAA. Still don't like it. So you do you, I own it. But I remember when I had a big practice trying to control other people's use of texting, right? And HIPAA compliant texting, I'm not even sure if that was a thing back when I had a big practice. I'm sure it was, but that gets back to known issues. I didn't know it then, I know it now. A known issue would have been, hey gang, our texting software is not HIPAA compliant. What makes software compliant? If they agree to share liability with you. They will agree to this in the form of something called a business associate agreement. I know I hear a lot of people say, well, I have the people who come in and, empty the trash cans and clean my office. I have them sign a BAA. Folks, are they really agreeing to share liability with you? If it comes down to it and there's a fine, you think that they're going to share liability with you, right? A BAA is signed by a company, a corporation, who is good at what they do, and they understand protecting health information, sensitive information. So a software company, I'm using like texting software, for example, is HIPAA compliant when they offer you a BAA. You read the BAA, they understand the risks involved with texting, and they agree to share liability with you if something happens, right? It's not like you're building this lead wall and, oh, now I'm protected. No, now you have some protection and you document that because it is something you can control. As a business owner, you can control what software your company purchases. Same thing with email, right? If you don't have HIPAA compliant software for your email, but you're allowing your therapist to use email to contact clients, that is a big known issue. And it's not unheard of, right? I don't want everybody to, be freaking out right now. A lot of times, new practices, you don't have the cash to spend on elaborate, expensive software. That's where your policy and procedures comes in. That's where your orientation comes in. That's when you look at everybody, you look them in the eye and you say, hey guys, we have a known issue. And that known issue is we don't have HIPAA compliant email, or we don't have HIPAA compliant texting software. Someday we will, but until we do, our policy is we don't text our clients, we don't email clients, we don't send protected health information via text or email, et cetera, et cetera. And you put that in black and white because it's a known issue. Now, if you continue to use the non-HIPAA compliant stuff, it's still a known issue. But now look at, and now here's our second column, things you cannot control, right? Because you really cannot control personalities, right? If you've got somebody that you've hired and they're like, well, you know what? I've been seeing Stan over here for 2 years. And if I don't email him, he's going to think I abandoned him. So you know what? I don't care what it says in my comprehensive employee training and my comprehensive policy and procedures manual that I signed. I'm going to email Stan. Can't control that, can you? So that's where in your policy and procedures, you must have a progressive discipline plan, right? What are the consequences if this personality decides to go against their training, right? That's not a known issue. You don't know what people are going to do, and nor should you. That's not your job to read minds. Your job as a business owner, as a practice owner, is to do what you can do and control the things you can control, keeping in mind that there is no grandfathering in, right? The other thing you need to let folks know they need to know if they're working for you, that liability falls on everybody, right? It's not like you're the business owner and you're some kind of lightning rod and it's all just going to be, whoop, it's on you. If you're a rogue therapist who insists on using non-HIPAA compliant email to contact Stan, somehow notices there's a breach, that liability falls on them as well for the same amount of money, the same consequences as far as who they have to notify, how they have to notify, et cetera, et cetera. It falls on everybody to follow HIPAA. So when we look at failing to conduct security risk analysis, that is easy to control. If you're the practice owner and it's just you, you're also the HIPAA officer, the compliance officer. So you're going to be responsible for making sure that everybody are making sure that you go through everything with a fine-tooth comb. All right, I'm going to let somebody in. So when you're letting people come into your practice, we all already talked about that. That's a vulnerability, right? Well, when you buy new software, when Apple changes their operating system, when Windows updates their operating system, if, I don't know, you buy new laptops for everybody, you have to conduct an audit of all of your systems and document the HIPAA compliance, of course, have your BAAs. You can actually download those, keep them in a folder, and document your known issues and explain, look, we know we don't have HIPAA compliant email, but we conduct an orientation twice a year and we update everyone on the status of our HIPAA compliance, and we train them to not use email. And in our policy and procedures manual, here are the discipline steps that we will carry out if someone goes against how they're trained and decides to use that anyway. So doing security risk analyses at least once a year, absolutely, when you get new equipment, new software, et cetera. Lack of adequate security controls. That goes down to, there's physical security and there is, electronic security. So you just want to make sure, for example, you don't have, I don't know if you've been to the hospital lately, but one of the things, there's a computer, right, in every room, and there are computers in the hallways. And you'll notice that there are screen covers. There are ways that you can't see information from the side. So those are security controls, ways to manage, getting into a building. Who's got keys? How do you get into the file drawer? How do you get into the EHR system? Failing to conduct vendor due diligence. I just filled one of these out today. I'm going to be a vendor for a school district. I'm providing their 40-hour training to become a supervisor in Texas. I have to fill out an entire packet as a vendor as their due diligence. Outdated HIPAA policies and procedures. If you listen to Ashley Hubbard at our 2023 Group Practice Summit, she talked about how in-depth your policy and procedures manual needs to be so that folks understand exactly what's expected of them at your practice and what will happen to them at your practice if they get out of line. I still have a cough. All right, let me make sure. Hello, wake up, Mac. There we go. Failing to implement data backup and disaster recovery. Most of us have this. If you have electronic health records and you're paying a company like, electronic health records are us, you'll find in the fine print that you've also purchased disaster backup. You've also purchased accidental deleted backup, right? So that's important to keep track of the 7 years, right? If you are still, if you still have a file drawer, hopefully it's a fire safe file drawer, right? You want to make sure that there are adequate data. And don't even get me into, are we supposed to be EHR and off of paper by now? There was a question, I think it was this morning or yesterday in one of the groups about how to get rid of records. Well, delete means delete. So if it's 7 years and 1 day and it's time to delete those records, make sure that the company that you have hired to handle those records gets rid of them completely, right? That should be in the fine print somewhere. Document that in your HIPAA log. And then we've already talked about a lack of comprehensive employee training. So what it comes down to a lot, we talk about violations and known issues. You know what you can control. And I know you guys. I've seen how detailed you guys can be. And I mean, some of you, like, you almost like salivate when you think about constructing a good policy and procedures manual. It's like, oh boy, yeah, let me get into it. I feel that, right? I mean, I think we're the same people who enjoy a beautiful Excel spreadsheet. It's like, oh, it's perfect, right? Here's the problem. You've got to still be the boss. Some of us forget, as practice owners, you have to be the boss. You have to be the enforcer. So when it comes down to those things you can't control, like if you find out your unlicensed staff is talking about their phone calls in a break room, and you find out that licensed therapists are having conversations in a public bathroom, and that or the walls are thin or something. If you find out that things are happening that you cannot control, or like I mentioned earlier, your rogue therapist is going to email Stan whether you trained him that way or not. Sometimes it still comes down to you and your level of assertiveness, your level of confidence. You've got to be the enforcer. You have to be confident enough to call this person out, let them know, okay, this is what you did. There was no breach, so I'm going to give you a verbal warning, or this is what happened. There was no breach, but this is the second time I've talked to you. You're getting a written write-up. If it happens again, you're fired. End of story. And document that you have an employee or 1099, and that's last week's training. I'm not going to get into that. You document that you have someone exhibiting risky, non-HIPAA compliant, non-company compliant behaviors. And now this person, unfortunately, has become a known issue. So how you handle that as a business owner, that's something you can control, right? So let's go to kind of go over what I talked about. I shared a screen so that you could see the Health and Human Services website, and yay, it was working. But you also learned that there are other websites out there that can give you an idea of common errors that people make, business owners, practice owners make. Now, Health and Human Services will give you more details about how those issues were fixed and what the folks who, got in trouble, how they made it right, how they made it better, how they made restitution, how they informed people. So if you want more information about that, go there. You learned about things you can control, and that's the known issues fall under that, and things you can't control, and then what to do. We talked a little bit about violations, right? Understanding that if someone is doing something against the way you trained them, you've got to step up and be the boss. So that's pretty much it for this training today about HIPAA and known issues. I am going to hit pause. I'm Dr. Kate Walker. Thanks for watching, and here comes pause.